The BELLINI is a phase 3 trial that looked at the impact of adding Venetoclax to proteasome inhibitor Bortezomib and Dexamethasone in patients with relapsed multiple myeloma. Now, Venetoclax is a small molecule targeted inhibitor of BCL2 protein. Preclinical studies as well as the phase 1 trials have shown that Venetoclax can be effective against myeloma, and when combined with Bortezomib can lead to a synergistic combination with high rates of efficacy. So this phase 3 trial demonstrated that there was a doubling of the progression-free survival when you added Venetoclax to Bortezomib and Dexamethasone. However, as has been presented before, we did see an increased mortality in patients getting Venetoclax compared to the patients just getting Bortezomib and Dexamethasone. So with longer-term follow-up and with more in-depth analysis of the various subgroups, what we found was that patients with a translocation 11-14, which can be found in as many as 20% of patients with myeloma, the addition of Venetoclax to Bortezomib and Dexamethasone significantly improved the progression-free survival without impacting the overall survival. Along the same lines, patients with higher expression of BCL2 by gene expression studies also showed a significant PFS benefit without a significant mental effect on their overall survival. In contrast, patients with high-risk cytogenetics like 414 in particular, or patients who don't have 1114 and have a low expression of BCL2 by PCR, those patients did not seem to derive much of benefit by adding Venetoclax to Bortezomib Dexamethasone, but in fact had a significantly elevated risk of death when Venetoclax was added to Bortezomib Dexamethasone. This trial tells us that Venetoclax is an active agent. However, it is effective in certain subgroups of patients with myeloma. So it paves the way for a biomarker-driven or biomarker-selected therapy for myeloma, which we hope will be available based on the results of ongoing trials, like the CANOVA trial that is comparing pomalidomide dexamethasone to Venetoclax and dexamethasone.